Hemorrhagic variant, along with the typical manifestations of dariers, at the acral areas you have well demarcated areas of hemorrhages. And in the segmental type 1, you have mosaic patterns. So you'll have linear lines where the darier disease or where the plaques and all are found in much more frequency, like they're found more frequently than elsewhere. But in type 2, there is a generalized involvement of the body. Now on path you will see corpse ronds and corpse grains, which are basically enlarged keratinocytes which are darkly staining, and corpse grains are found in the corneum and ronds are found below them. Grains are eosinophilic. Grains have eosinophilic cytoplasm which has collapsed keratin bundles and contains shrunken parakeratotic nuclei. Now, this HPE is similar to what we see in Grover's disease. We see epidermis overlying acantholytic and dyskeratotic foci is thickened and shows papillomatous and papillomatosis and hyperkeratosis. Dermis has perivascular infiltrate, and epidermis is thickened and shows papillomatosis and hyperkeratosis. So these are the findings which you see in Grover's as well. Differential diagnosis includes acrokeratosis verruciformis of Hoff, in which you only see flat wart-like presentation. So it resembles more like P. versicolor, but you'll see flat wart-like presentation in acrokeratosis verruciformis. Severe seborrhea, Grover's disease, darier. But how do you differentiate Grover and darier? Darier has involvement of acral skin, the nails and oral mucosa. Family history might also be a clue to diagnosis of dariers. Now treatment. So basically differentials could also be pemphigus vegetans, blastomycosis like pyoderma, Hailey-Hailey disease, pemphigus vegetans. How do you differentiate? On HP it's very easy. And on the treatment for Hailey-Hailey is lightweight clothes, sun protection, basically topical retinoids and oral retinoids, the ones that you have to give. Now isotretinoin, acitretin, L-tretinoin, they produce significant improvement in 90% of the people. Because of the side effects, you'll have to stop the therapy in between at times, and individual dose you'll have to titrate to optimize risk benefit ratio and avoid excessive dose related side effects such as mucocutaneous dryness and elevation of serum lipids and liver enzymes. Intermittent therapy is also a useful approach. Surgically, you could excise and do a split thickness skin grafting. You could do dermabrasion or laser removal with CO2 or erbium YAG laser. You could also remove the follicular infundibula to prevent recurrences. You could now experience necessity to avoid scarring. Okay, you cannot just go and excise, and there might be a risk of hypertrophic scar or keloid formation if somebody who's not experienced and does it. Erbium YAG laser might be better than CO2 laser. This is a patient with Darier's disease. Here I basically want to emphasize on the dirty, warty, greasy plaques, and they kind of have a seborrheic distribution. So yeah, dirty, warty, greasy plaques, and I very clearly remember that they were very foul smelling, and the patient had recurrent infections, and the patient was put on isotretinoin, and we had to keep putting her off isotretinoin also because her FLP started to get deranged. But the response with isotretinoin was very good. So yeah, that was all about Darier's disease. We'll discuss some other disease someday soon.